Hi, welcome to Relief Medical Group in our four-core system. I'm Ed Cremata and I'm the Nursing and Rehabilitation Coordinator at Relief Medical Group. Today I'm going to answer some questions and talk a little bit about one of our programs that fits within our Live Better part of our four-core system. And this is, sort of a mouthful, but basically we want to set it up so that you'll live longer, healthier, and significantly reduce your chances of developing many diseases. Now that's a huge claim, but you would be surprised at what the scientific data is telling us today about how much control we have of what ails us and in many cases what kills us. As of right now, the evidence tells us that 40% of the population in the United States has something called metabolic syndrome. What that means is 40% of the population is actually pre-diabetic. That means that our blood pressure is going up. That means that our inflammatory markers, these little chemicals in the blood that make everything inflame, including your blood vessels, are going up. So between blood pressure, between sugar instability, we're heading toward disaster. The good news is that if we knew how much direct control we had of this condition, we can prevent most diseases like diabetes. Not all the time. There's some diabetes that we can't really control, but most diabetes we can. If you go to the American Diabetes Society website, if you go to the American Cancer Society website, it is amazing how much control we have just by what we eat, whether we exercise, if we eliminate bad habits, things that are obvious like smoking and things like that. It is amazing how much control we have of how healthy we are, how much we can enjoy our lives, and what we die from and how early we die. So with that in mind, what we like to do is sit down and meet with you and look at your specific lifestyle, look at your specific diet, and if you're interested, we could actually look at these inflammatory markers in your blood. We could do some lab work and see just what your risk is. And I'm not suggesting that we want you to live like a monk. You don't need to necessarily live a vegetarian diet and exercise 2 hours a day, but essentially just to make some changes. There's a lot of talk about genetics, and we're hoping to find, cures for genetics to prevent disease and keep us healthy. And let me just, break that myth to you. We've gone a long way. There's a lot of things we can do with genetics, but it's never going to have the effect that changing your lifestyle will. If you think about it, we've had huge increases in degenerative diseases like cancer and diabetes, and yet our genes have not changed much over the years. But our environment, our lifestyle, our eating choices have. So if you take a typical example like diabetes, there's things you can do to see what your risk factor is. Remember, 40% of us are already in that risk factor of metabolic syndrome. So if you have an interest in something like this, we can guide you through that process, and we really can live up to our promise with your help of essentially helping you live healthier, helping you live longer. So if you have any interest in this subject, which I hope some of you will, of preventing disease, of being healthier, please contact us. You can talk to me personally on my cell phone at 510-913-1366, or you can call the office at 510-796-2225. If you have questions about the specific diet program that we use, for example, to help us meet these goals, ask for Danielle, and she's our nutrition coach. We'd be happy to answer questions about that. But any of our providers would be happy to answer questions for you at any time at no charge to you. Thanks so much for listening.